The idea of handoffs is one that's a little difficult to wrap your brain around.
It sounds like it's something that's not very difficult, but it's very complicated to make sure that you get the right information to the right people at the right time.
Every transition of care provides opportunities for errors, whether it's a transition between nursing shifts, between physician shifts.
You have physicians talking to physicians, nurses to nurses, nurses to physicians, other providers involved in the mix.
It's an issue that everyone has recognized is a problem, but no one has found the solution to it.
We will be looking at new ways of delivering health care that are going to challenge very much the status quo. The system is delivering the results it is designed to deliver right now. And if we want different results, we have to change the system. Every root cause analysis that we go through for a Sentinel event identifies communication as the leading issue. 70%
of adverse events nationwide are results of poor communication.
Miscommunication or lack of communication often either interferes with the timely intervention on the patient's behalf and or potentially even the inappropriate intervention on the patient's behalf.
And when we can improve the communication between caregivers during a transfer, we can prevent patient harm.
They all need to be singing the same song, heading in the same direction, working in the same way.
It's an obligation to the next provider to give them all the information that we have and we've learned about the patient. But I think it's also an obligation to the patient, who I think they have every right to expect that we're working as a team.
And I think the opportunity to get everyone together, to develop a common definition, a common language, a common understanding, a common process for measuring and improving this will be simply outstanding and something we couldn't have achieved on our own.
We wanted to get experts together who knew the methods so that we could produce these solutions on business timeframes and get them out to the delivery system as rapidly as possible.
What we hope will happen is that through the collaboration between different hospitals, together we can be smarter than any one of us could be alone.
I think it's exciting as well to have the opportunity to do something that may actually affect the way medicine is practiced in the future.
As we start the center's work, I would measure the current success by the level of enthusiasm that we've generated among the leading hospitals and health systems that are working with us to solve these critical quality and safety problems.
If we reduce the number of unanticipated events and at the same time increase the satisfaction among providers and among patients, that we will likely have accomplished our goal.
And handoffs are a major contributor to bad outcomes and avoidable complications, and that's why this issue is so critical to the Joint Commission and to all of us.